Hello and welcome to Senior Journal. My name is Paul Roberti. I am your host for today's show. The topic of today is shingles. And why are we discussing this? Because every time you turn around on TV, there's a commercial for it. And if you got chickenpox when you were a youngster, you are very prevalent to getting this disease. My guests today are Sue Stenhouse, Executive Director of the Cranston Department of Senior Services. Next to Sue is Mr. David Goldsmith, co-founder and president of MedMates. And next to Mr. Goldsmith is Mary Lou Pearson, RN, nurse at the Cranston Department of Senior Services. Sue, why are we sitting here discussing this topic?
We are very excited to be on the program, Paul, to announce this incredible collaboration between the Cranston Senior Enrichment Center, the seniors of Rhode Island, and of course MedMates, an organization that helps promote collaborations, especially in the medical field. But we're here today because Mayor Alan Fung believes in our facility beyond all of our other missions to help seniors, but it's also to help the research mission. And when we were approached, we jumped right on board to be part of this study, to study the effects of a special cream to help relieve shingles pain and suffering.
Okay. Now, before we get into the actual product, let's discuss, first of all, what is shingles, Mary Lou?
Good question, Paul. Shingles is a blistering rash that occurs from a virus called varicella, which is the chickenpox virus. So if you've had chickenpox in the past, and most adults over 40 have had chickenpox, this virus goes to sleep and it awakens and causes the condition known as shingles.
But is there any reason why it awakens?
A number of factors. Aging is one factor because as we age, our immune system is affected. Other things, stress, certain times of your life or conditions can actually cause this virus to awaken and produce this condition called shingles.
Okay. What are some of the symptoms if I get shingles?
Shingles produces symptoms sometimes 2 to 4 days prior to this rash developing. You can have some numbness or tingling in your skin, and the two areas that are prevalent are your face and your mid to around your body, and it usually follows a line. The symptoms are vague. Sometimes you can have a fever, sometimes a little nauseous, similar to having a virus. Mm-hmm. And then at that point, the rash develops. The rash occurs and produces these blisters. And the blisters will actually scab over or harden within 7 to 10 days.
How long is it manifested once it develops in an individual? How long will that last?
It can last
without going into the product that David's going to talk about. If I don't use this product, all right, how long will it normally last?
Symptoms will vary, and they'll last for weeks, 2, 3, 4 weeks. Untreated shingles can produce a neuralgia, a nerve pain that can last can last for years. It can be very debilitating. Okay. So what we want to do is act fast, use a product that will help calm the skin during the outbreak. Mm-hmm. Be careful not to come in contact with the blister, the wetness that the blister would produce, because that's how it can be passed on to someone else.
Okay. Go ahead.
Importantly,
yes.
You can't get shingles from a shingles patient, but someone who has not had chickenpox that is exposed to someone with shingles could develop chickenpox. So we caution people with shingles to stay away from young children, mm-hmm. pregnant women, and obviously not to scratch, not to touch or break those blisters. Keep it clean, cover it dry with a dry dressing, and use this product to calm the skin, stop the itching, and sometimes that burning sensation that'll go along with the symptoms.
All right. Now,
Yes.
I have chicken pox. I got chicken pox when I was a little kid, a little boy. And now they're saying, get this vaccine. How well does this vaccine work? And should I go out and get it?
Yes. Are you 60 yet, Paul?
I am 63,
Okay.
by the way.
Anyone at 60 years and older that have
Yeah.
had chicken pox should get vaccinated with the shingles vaccine.
Okay.
Please have a discussion with your physician. The vaccine actually does have a live virus, so you need to be with talk with your physician to be sure that the timing is right. But anyone over 60 should be vaccinated. The vaccination will help you with a milder case of shingles if one develops. So you can get shingles before and after a vaccination. You can also get shingles a few times, but it will lessen the symptoms. It'll lessen the time that this virus is awakened and producing this discomfort.
Okay. Now, at your time at the Cranston Senior Department of Cranston Senior Services, how often have you seen seniors come in with these symptoms and with shingles? And how, excuse me, before you answer the question, how common is shingles occurrence in Rhode Island by any chance? Do you have any statistics on that?
1 out of 3 people will develop shingles. I do see a couple times a year patients will come into the office with this rash or complaints. I'll look at it, send them to the doctor so that they can get on an antiviral and start treatment for the condition.
Okay. So 1 in 3.
1 in
That's
3.
That's a
pretty
lot.
good.
That's a lot
Yes.
of people in the course of Rhode Island, the occurrence in Rhode Island, but also all over the country that could get this.
And,
this
and,
occur-
and, and as one ages, the incidence goes higher. When you're over
Yeah.
85, I think it's closer to 50% chance or more.
Okay, so David, let's talk a little bit about MedMates. What is MedMates? What does this company do?
Sure.
What is your
yeah,
function
yeah.
within
MedMates is
the
not a company. It's a nonprofit organization based in Rhode Island, and MedMates Incorporated. Go to medmates.org for understanding of what we're doing. But it's a collaboration between the hospitals, the healthcare delivery system, the colleges, Brown University Medical School, University of Rhode Island, and all of the companies and researchers involved in healthcare technology. The purpose of the organization is to facilitate connectivity and collaboration. The end game is to improve quality outcomes in healthcare and to identify opportunities for growing what we refer to as the healthcare technology ecosystem in Rhode Island, which is collectively it's all of the companies that are involved with healthcare technology that have an opportunity to collaborate. It's also working with the students and the faculty in the schools and helping them. A lot of people have great ideas for products, including patients have great ideas for products or product improvements, and those ideas go nowhere because they don't have the facility to move those ideas into moving them forward to become products. MedMates was formed to facilitate working with students and faculty and researchers, including physicians and surgeons in the hospitals, to help provide a vehicle for them to take the idea and to move it forward first off to find out, is it a really good idea? No, it's an idea that already exists. Or it's an idea that was around 50 years ago, but maybe you have an improvement on it. Or it's a breakthrough idea and that potentially warrants funding. So MedMates exists to facilitate that whole process, to grow the healthcare technology sector, much the way it's been happening up at MIT and Harvard in Cambridge over the past 20 years. It has blossomed. It is one of the hotbeds of healthcare technology growth in the world, right up in Boston, and we get some of that benefit. So we formed MedMates just about 2 years ago. We kicked off, I think Sue came to one of our first meetings. We had 50 people show up at our first meeting. It was really just an exploratory, is this a good idea? Today we have over 650 members. We have representatives from CVS and Amgen and Davol and Claflin, which is one of the oldest distributors in the U.S. of healthcare products. Lifespan, Brown University Medical School. So it's a collaboration. We had a program just last night on the legal aspects of launching a product in terms of intellectual property and patenting and formation of entities. And so every month we have a different program.
Okay, let's discuss this product right here. How did that product first develop at MedMates? And talk a little bit about
So this product was developed by a Rhode Island company and that does research and development of topical medications. And so I'm aware of this product, and so Sue, having been a member of MedMates, we wanted to launch a study specifically around shingles using this product. And we're actually doing the same thing in Baltimore, in the greater Baltimore area, working with it. So I reached out to Sue, knowing that she had access to a senior population that is prone to having shingles.
So that's how the relationship developed,
exactly.
right there.
Because the whole point of MedMates, again, is to look for opportunities for collaboration to create value at the end of the day for patients. And so I reached out to Sue and we discussed, geez, is this something that you'd be interested in? And she was all over it. And now we're rolling this out to all of the senior centers in Rhode Island. But it's also, enrollment in the study is available to anyone in Rhode Island that is presenting symptoms of shingles that can enroll in the study and receive the product for free to determine and answering a daily questionnaire over a 4-week period to determine whether the product is beneficial for them. And it's part of a study to determine to quantify the effectiveness of the product.
So how many seniors would you have to test in order to be able to get a quantitative analysis of that product?
Yeah, about 100.
So you need about 100 seniors to come to the Cranston Senior Center.
Across the country.
Across the country.
So between what we're doing here in Rhode Island, the entire Rhode Island population, coordinated by the Cranston Senior Center, and our study going on in the greater Baltimore area, and we're rolling it out in other parts of the country.
And that product was developed just for the disease of shingles, correct?
It was developed specifically for people with shingles, and it was developed here in Rhode Island.
Okay.
Yes.
Let's see. Sue, how can folks sign up to participate in this particular study?
Well,
what do they need to
we've
do?
made it as easy as possible. In fact, and part of the reason that we thought this was a good fit was because we have an incredible medical team at our senior center, which is unique. That is not an amenity that most senior centers have. So we became home-based for this study. It is very, very simple. Folks just need to call the senior center. We've already had a few referrals from other senior centers to help facilitate. Mary Lou and we have other medical staff at the center that are up to speed. They usually chat with the individual just to make sure that they do qualify for the study. It's not a big litmus test, but we do need someone that has been diagnosed with shingles, and they have to be diagnosed fairly recently. That's the best, way for us to really document the effectiveness of this product. But it's really simple. Just for a short period of time, we provide the study format. You just check off boxes daily as to what your symptoms are and how you've used the product. And then it just gets faxed into us, or they can drop it off or put it in the mail, these forms to us. And then it's all confidential. And then Mary Lou then processes the forms and then sends the data to David. And then they start putting it into their matrix for their study.
All right. If you would like to be part of this study, you can contact the Cranston Department of Senior Services at 1070 Cranston Street, Cranston, Rhode Island, 02920. Their phone number is 401-780-6000. And just call that number directly, and they will contact David or Sue, and you can take a questionnaire. Is there a questionnaire that they have to follow in order to be part of this study?
Yes. And what happens is that call will be filtered to actually Mary Lou or somebody else on our medical staff if Mary Lou just would happen not to be there on that particular day. But Mary Lou, why don't you tell them what you do with the patient?
I meet with the patient. I like to examine the area to confirm the shingles diagnosis and to look at the site. I talk to them about the study, explain the ointment that we're using. I review the paperwork. It's very simple to, on a scale of 0 to 5. For instance, what your pain level is, what your rash looks like, is there any drainage, is there any pain, has the pain improved? So there are basically 5 or 6 questions to that effect that would help us determine the use of the ointment and the results that we would have. Usually tell the patients to start off using it 3 times a day. They can increase it to 4 times a day. If the area is blistery and weepy, I advise them to use a glove, but once that skin is dry, just rub that ointment in. It's soothing and not greasy and really easy to use.
Now, David, is it best to use this agent as soon as the patient develops the symptoms? Is it more beneficial to get it as quickly as possible?
So that's part of the nature of the study, and is to capture that information. So in the enrollment form, when an individual is being enrolled into the study, part of the question is, how long have you had it?
Right.
So we're just capturing that data. We're not making any determination. So, for instance, they could, if they have a tingling sensation, but no rash yet, and they say, oh, this may be shingles, they could contact the center. Sue could say, well, that may be shingles. I'd be happy to provide the ointment to you. And they could potentially put it on right at their tingling sensation, and the ointment may provide benefit at that point. And if it did, the data would be collected, and that would be just a fact that we would just record. If they've had shingles for a week or 2 weeks, meaning they've had a rash and they have pain for a week or 2 weeks, and that's the starting point, then that's the starting point. If they've had post-herpetic neuralgia for 2, 3, 4, 5 months, and they say, I want to see if this will help me, fine, enroll, and it may not. Again, the point is to use the ointment, record the data. The facts will prove out at what point in the stage of a shingles the product is effective, or more effective, or less effective in terms of improving the appearance of the skin and the comfort of the skin.
Okay. When did this study begin? When did you start this?
We just launched this in January.
So it just began in January. David, is there going to be a time frame perhaps as to how long this study will run, or are you going to run it until you get at least 100?
We'll probably run it until we get
individuals?
100.
Okay.
Yeah, so whether that 100 comes locally or scattered across the country, but I mean, it could be at any time, but it's probably going to continue because the value is, at the end of the day is in the data.
Okay. And then
Yes.
there will be some type of a follow-up, I'm sure. And now, I got a question. Once I get shingles, all right, is that the end, or am I prevalent, Mary Lou, to get it
You
again?
can get it again.
Really?
Good
Yes.
news.
Good news, everyone out there.
But the,
Once you get it
the
the
best
first-
news
Yes.
is that although you can get shingles
A
repeatedly,
second time or a third time?
once you're vaccinated,
Yes.
your chance of, you will actually reduce the symptoms.
So can I get, okay, I got a question. So can I get shingles the first time, use this product, all right, and I get rid of the symptoms and the shingles is gone. Now, can I go and get the vaccination right after I get shingles the first time? And will it reduce my chances of getting shingles a second or a third time?
As I said before, Paul,
Yes.
when you need to have this conversation with your physician,
Okay.
if you start with shingles symptoms and get diagnosed with shingles, and you have not had the vaccine, which is indeed what happened in my personal situation.
Ah.
I had to wait some time before I was actually vaccinated. So that decision will be made between the patient and the physician.
Okay.
But yes, you can get vaccinated even after you've had,
it
an
once.
outbreak of shingles.
Okay, good.
Yeah.
I'm glad I found that one out. Let's go on. Sue, what are the benefits and the risk of participating in this study? And you can all collaborate on this question because
Right.
I'm sure you have an answer, David must have an answer, and then Mary Lou must have an answer as to what are the benefits and the risks, especially Mary Lou.
Right.
Go.
Well, in the first place, you're getting a product that anecdotally has been found, or at least people are anecdotally have told them in the past that it has given some relief.
Mm-hmm.
So at the very least, you have the potential of getting some relief from this product. This product also normally sells for $40 for that container. You're going to get it for free. So that's another benefit. And I would say that the risks are minimal, but I'll pass that along.
Okay.
Yeah,
David.
it's a non-drug formulation. All of the ingredients in it are classed by the FDA as safe and effective. So there should be no side effects from using the ointment. There's nothing in here that's harsh. It should be soothing. Again, it would be up to the individual patient to determine that and to record that. As you know, shingles, when somebody has shingles, their skin can be hypersensitive. Typically, they'll get it on one half or the other. It'll start around here and go around the side if they have it on their torso. And so applying the ointment can be, by itself, discomforting, but once you get past that, the ointment may, and again, this is to be proven, may help reduce the discomfort. And just so we understand this, and going back to risk, to date, about 40,000 jars of this have been distributed prior to the study. So we've the company that makes this has received anecdotal feedback from hundreds of people, but there's never been a study done. So the purpose of this is to do a study and to quantify what has been anecdotally shown to be effective.
And it's FDA approved.
It is an FDA registered product.
Okay.
Yes, exactly.
And right now, this test started in January. How many individuals have been tested so far at the Cranston Senior Department of Services?
We've had two
2
participants.
participants already.
One
And-
has completed a 4-week trial, and the second person also completed it this past week.
And what have you seen so far?
Well, looking at their sheets, there's been improvement in appearance, some improvement in symptoms of itching, some pain, and pretty much some relief with the product going into the 4th and 5th week. The participant had the outbreak probably 10 to 14 days prior to using the product. So as David said, it'll be interesting to look at the data to see at what point and how the product is effective. Depending on the area, you might need someone to help apply the cream, and a caregiver or someone to get the entire area. And the first 2 people actually used 2 jars of the cream because of the area. Now, if you have, typically, shingles follows a nerve path, so you can have it on your face. It can affect your eye. We do not want to use this product in around the eye,
Right.
but you can use it on your face.
Okay. And once I'm in the study, can I drop out of the study for any reason I deem necessary to do so?
Absolutely, absolutely. This is a free will study. We're looking for referrals for people to come to us to participate in the study. But if for some reason all of a sudden it became cumbersome, we've made it as simple as we possibly can. But absolutely, if anyone needs to drop out for whatever reason, but then we would document that.
Okay. One last question. We got about a minute to do it. And David, what's next?
How do you mean,
What's next for this product in the development and what you're going to be seeing in the future? What is it that you want to get done?
As the product is being validated in terms of effectiveness, that will be shared to geriatric physicians, primary care physicians, directors of nursing homes where they may have patients presenting with shingles, the entire senior population. If there's a product that can be beneficial to people with shingles, because there's not that many products available currently on the market that can be used, especially topically, to be benefit. So if this proves to be beneficial in terms of the data, that would be important information to share across the board. And by the way, I just want to be sure that we're reaching out to the Rhode Island physician community in this as well. If anybody is hearing this, they should contact their doctor.
I need to cut you off because we're running out of time. I would like to thank my guests, Sue Stenhouse, David Goldsmith, and Mary Lou Pearson, for taking the time out to be on Senior Journal. Here's an opportunity for you to get out and be part of a study, or if you know of anybody that has shingles, to be part of this study. Greatly beneficial to you. Thank you for taking the time out to view Senior Journal. My name is Paul Roberti. I am your host, and thank you very much. Get out and volunteer. Make it a great day. Thank you.
Thank you.
You guys were fabulous.
Thank you so much, Paul.
All three.
Thanks, Paul.
My
Thanks,
pleasure.
Paul.
Mary Lou, awesome. Thank you.